I'm so pleased to be with you here today. It's always my privilege to be able to give you an update April of every year and how Spark is doing, what we're learning together going forward. And I'm very pleased to be able to highlight many of the research match studies in particular today and how we're learning over the life course. That'll be a theme that I hope you appreciate. Within this, we'd love to hear feedback from you about studies. We just met with our Community Advisory Council last night and was great hearing the feedback in terms of topics of concern and being able to think about how we inform researchers about those interests. And you'll see that many of those, actually, I'm very pleased that we have data already. So without further ado, I'm going to give you an update, especially about the last year and cumulatively what we've been learning from Spark already. I'll say that we're going strong, and as we're going forward, try to think about, like I said, longitudinally or over time, how things are changing. The world is changing around us. People in Spark are getting older, and with that, I'm very excited to see new opportunities for people. And as we're learning together, be able to hopefully catalyze some of these advances, both advances in the science, advances in technology, and an ability for ourselves to share with each other. So as we go through with this, for any of you who are new to the community, why are we doing this? What are we trying to do? I think there's, for all of us, the desire to be able to help each other through this journey, help to understand many of the why questions in terms of things that contribute to autism. And the reason for doing this is to ultimately improve lives, hopefully for everyone in some way. But we know that's going to take a while, and we're committed in terms of knowing that that does take a while. As we do this, we know there are many differences, even though we use one word of autism to talk about many, many different people. We know there's heterogeneity, and because of that, we want to have a large enough number to be able to answer questions for many different people, whether you're male, female, no matter how you self-identify, where in the United States you are, what your challenges might be, where you are along the age continuum. We want to be able to ask and answer questions for each of you. And so with that, we need a large community to do that. And I do fundamentally believe that by using data, using research, we can come up with answers that will inform how we go forward. And that's what we're trying to do. Less trial and error and more data to inform future supports. So what have we done so far? We've been at this quite a while, since March 2017. For those of you, again, who are relatively new to the community, I think of us as having two different dimensions. We have 30 clinical sites around the United States. These clinical sites are, I think of them as exceptional centers of excellence with clinical researchers and investigators who are absolutely top-notch. With their expertise, with their ability to be able to work with individuals, we also have the online, or what I call Spark Central team. So with that, we have supports across those clinical sites across the United States and with people centrally here, including the team that you met today with today's webinar, being able to support communications, distributing information back to the community. You're going to hear about return of genetic results, although that's just one component. It is an important component for some. And with this, as I said, being able to power, importantly, learning together. And so I think of this as an iterative cycle. It takes cycles of asking questions, finding out the answers to those, communicating those out to you, and coming up with more and more refined questions as we go along this journey. We also are funded by the Simons Foundation, and the Simons Foundation also funds research, some of which uses the Spark community through research matches I'll be talking about. And so there are multiple dimensions in which the community is supported through these efforts. The community is getting large. I'm excited to be able to say we have about 1/3 people that are participants in Spark. That includes individuals with autism, both young and old, so both children and adults, as well as their family members who are participating. And so with that, really an enormous number of people working together to be able to ask and answer questions. As we think about this, I've met so many times researchers who are top of their fields, but they may not be, and they may not be autism researchers. They may be individuals who think about underrepresentativeness or issues in terms of not being able to get access to care or access to services. People that may even be people thinking as social scientists, others as neurobehavioral scientists, but they may have lots of important and good questions to ask, but they may not have, there may not be clinicians as an example, and they may not have access to individuals to partner with. So we've created Research Match as a core part of Spark, which is researchers who come to Spark to be able to work with us to do their research. And I say work with us in the sense that we connect them to you. We connect individuals who are Spark who meet their eligibility criteria, in other words, who are in the range of whatever it might be, age as an example, to do that measure. That might be something that's done online in the comfort of your own home, or it might be something that's at a clinical site. But as we do this, we try and make it easier for good researchers to do research, and we make it easier for you to participate in that research. That was one of the sort of core reasons why we established Spark in the first place. I'm very proud to say that already there are 130 scientific papers that have been published in what we call peer-reviewed journals, so places where people were very rigorous about seeing if science was done correctly, and it spans any number of different topics. I'm going to actually highlight some of that research today. And it includes everything from issues of mental and behavioral health to genetic studies, and is even, I hope one day, going to be think about different interventions and being able to rigorously test those interventions to improve lives. As we do this, we love hearing about the topics that are of interest to you. In part, we can see some of that interest because we have webinars across these topics, and we see who listens in and who's reading what topics. And we try and communicate that back out to researchers so they know what the unmet needs, concerns, and interests of the community are. As we've done this, as I've said, I'm very proud of the communications team in particular because they work very hard to make what are sometimes very complicated topics and information to give that back to the community, to you, in ways that I hope are understandable. We are always striving to do better. So if there are either words we use or phrases that don't make sense, please let us know about it. But as we're doing this, we've both tried to send out individual reports. So for those of you who have done online measures for your own family, for someone in your family, being able to give that information back to you so that you're learning about your own individual with autism, but also to make sure that you're learning about others. So to be able to understand, for instance, what the broader community is seeing. And in doing that, we've created snapshots so that you can see what's going on in the larger community. We do webinars like what we're doing today, and we bring in many guest webinar researchers and clinicians, and then we try and share stories. And I think the stories actually, to me, are the most, many ways, the most important part, because it's an individual sharing what their experience has been. And I learn a lot from those of you who have been so generous in terms of sharing what your journey has been like. So let me dig down now into some of the data. Some of you are going to be very data driven and interested in data. So I have some graphs and charts in the slides. And again, this is recorded for any of you that want to dig in deeper. For those of you that are not so much data types, we've tried to summarize this in words, and you can just listen to me. You don't have to look at the figures as they're going by. Not everyone in Spark has participated in genetics, and that's perfectly fine. But for those of you who have, I wanted to give you an update in terms of what we've been finding and set expectations if you haven't heard from us about things. So for those of you who have sent in saliva samples, we've used that again to get DNA and to be able to do genetic DNA sequencing to see if there was a cause of a genetic contributor to autism that we thought was a major contributor. So far, we've analyzed just over 21,000 individuals with autism, analyzed their genetic data. And when we have information on family members, we put that together. We try and help that to interpret the information better for the person with autism. At this point, we've returned genetic results, or we've had a genetic finding, I should say, in just under 9% of participants within Spark. Now, with this, we continue to learn every single day, and so we're not finished yet. If there are individuals who we've sequenced before, we go back and continue to look to see if there are genetic genes and/or genetic variants that before we weren't certain of, but as we have more experience and more people, that we come more certain of and feel confident to be able to give those results back. So overall, again, the number's about 9% of everyone within Spark. For those of you where we don't recognize something as a genetic factor or something has not met the threshold for return, we have been sending an email that says we have no results yet. So that means that either way, someone should have heard from us, either no results to return to you yet, or in fact, a result for return. And again, just to recall, we have certified genetic counselors that are able to explain this information to you, walk you through what it means, and be able to put it in the context, hopefully, for your story. And then you can take that back to your provider. And this information can be helpful to your doctors, teachers, therapists, other people. So with that, as we break it out, it's been interesting, not surprising for us, but interesting to see that in the individuals for whom we have results, we more frequently identify a genetic result for return in females more so than males. And you'll recall that for autism overall, there's about a 4-to-1 male to female ratio. And it seems in females, we are more likely to find a genetic contributor, a major genetic contributor, I'll say. And within this, we're also more likely to identify genetic factors in individuals who have intellectual disabilities or significant neurodevelopmental issues. So just so that you have some sense of whether or not you yourself might be getting one of those results. As we look through those, as I said, we oftentimes have family members. And when we do have family members, we try and analyze the results within the context of the family. And in fact, for the results that we have for return, when we have those results, those about 9% of individuals, about 40% of the time we identify that that genetic result that we return is de novo. Just to put that in context, what that means is that we don't see that same genetic factor in the mother or the father. And therefore, even though it's genetic, it was not passed down and it was not transmitted. It started new with the person with autism and did not come from one of the parents. And that's actually not surprising to us. We've seen that pattern many, many times before, both with autism and with other conditions as well. In some cases, we don't have both parents, and so it remains unknown to us whether or not this was inherited from a parent or whether it was de novo. If we have one parent as an example, we may see that it wasn't inherited from that one parent, but without the second parent, we can't tell whether it was new in the child or inherited from the other parent we haven't analyzed. And in some cases, in the middle, shown the inherited factors, we do see a much smaller fraction of individuals for whom this is passed down from one or the other parent. So we see individuals in all of those buckets. You'll see the lighter and the darker shades of blue because there are two different types of genetic factors that we see. Some that are in a single gene, and we've labeled those SNV or single nucleotide variants. Those are the dark blue bars. Those represent a single gene. And then the CNV stands for copy number variant. Those are the light blue bars, and those represent individuals who have actually contiguous DNA segments. So it's usually not just one gene, but a cluster of genes that are next door to each other. But either way, as you can see, we see many of these that are start brand new with the child, or not even a child, but the individual with autism. In addition to that, we've been thinking about the results, the genetic results that would have significant health implications for which we're quite confident that have nothing to do with autism, but that would be important in terms of the individuals for whom they're relevant. And so I'm showing you in this figure here, the light blue bars are genetic results that were related to autism, are the light blue, and the dark blue bars are those related to secondary findings. And those secondary findings, what I mean by that is that they're not related to autism. They're, as I said, related to other conditions which are important in terms of health risk, and the risk can be significant and they can be life-threatening at some point in your life. And so based on that, we felt it was really an ethical obligation to be able to make participants aware of this information if we saw it, and to be able to allow them to take whatever action they would want to take care of themselves. I'm showing you on the x-axis over time, so you can see that we've been increasing the number of results that we've been returning over time, both those related to autism as well as those related to so-called secondary findings. And I can tell you, having talked with many of the families, that this has been for some, very impactful. Some who had no idea that this was in their family, especially for the cancer risks, something that they were able to use to think about cancer screening when maybe they were young and would not have already started cancer screening. So more often parents in these cases, but parents who might be in their 30s or 40s, and being able to use this information in a proactive way to keep themselves healthy. Just to let you know, we'll be continuing to return both of these over time, and this is for individuals who want the information. No one's under any obligation to take the information, but all of this, again, explained by genetic counselors with guidelines that we've written with Spark in terms of how to use this information that's tailored based on that genetic result, so based on that underlying either autism gene or on that hereditary cancer or heart risk. So I'm going to switch gears now, and I do want to put a shout out to the team that's been involved in this, the return of results team. They work hard on this every single day to be able to make sure you're getting good information. I'm going to switch gears for a second now in terms of talking about the research that's been done largely through research match studies and how we're understanding more and more. And I'll emphasize that I think we're understanding over the life course more. I think we still have gaps in our knowledge, especially about adolescents and young adults and older adults. And I'm glad to see we're starting to fill those gaps. And the other thing I'll draw your attention to is that we are starting to understand how people are changing over the life course, and in a good way. Again, the reason that we keep asking you different things over the years is because we are watching people as how their own journey is changing, how they're advancing, and trying to understand what those changes are that are different over different times in the life. And so I'll point out some of those things. I'm going to talk about a few different studies, and in each of the studies, just to help orient you to how you're going to see the slides, I've tried to include both pictures and names of the researchers doing the research. So these are all researchers external to Spark. They come from around the United States, from wonderful hospitals and universities. And again, they've been able to partner with you to be able to ask and answer some important questions. The first of these studies relate to what I was just talking about, the return of results and being able to understand what that's been like for you. I always want to continue to improve our processes, and hearing back from you about what the experience has been after we give you information and always looking to see how we can improve this was one of the goals that Dr. Klitzman and Dr. Applebaum had in terms of looking at this. And so they were looking specifically at a group of individuals who received a genetic diagnosis from Spark. All of these families, the individual with autism also had co-occurring intellectual disabilities. So it's a relatively small subset. And it was a relatively small number of parents, about 28 parents. And all of these genetic events were those de novo genetic events, or new in the child or in the individual with autism. So with this, I just want to be clear, it's a very specific, unique group that got these results that they studied. And in talking to those parents, and I do want to emphasize, they really, I think, got to understand how the parents were thinking about this. And I remember one of the first families that I learned from said to me, "It changes everything, and it changes nothing." And I think that theme really continues to resonate in terms of how parents are reacting to this. And what I mean by that, just to be able to explain, is that it means everything in the sense that many of the families continue to have this sense of better understanding of the why question, in terms of understanding better causation, what caused this, and in many cases feeling really weight lifted off their shoulders in terms of some alternative theories that they may have had. On the other hand, it also changes nothing in the sense that their child is still their child, the wonderful person that they are, and it changes nothing in that sense. It doesn't change the autism diagnosis, it doesn't change magically other things, but it does provide more information. And I think that information can be quite powerful for some families where there may have been information gaps. Finding other people can be quite helpful. On the other hand, I will say for some of the families that filling in that information gap may have, gained some clarity that maybe that they were hoping that it wouldn't, either bringing up an additional health risk that they weren't aware of, but more commonly, just being able to say that yes, this is something, and looking at other individuals who may have that other diagnosis, um, this is something that's going to be a continued concern. It's not going to go away. It's something that we'll have to continue dealing with. Within this, I think it's important just to know that and know yourself, really, as we think about how to support families as they go along this journey. Within this, one of the other things we've been doing more and more in Spark, and we have a wonderful group of families and advisors who help us to think about how to make Spark equitable in terms of access to participate, being able to hear really the choir of voices that we need to hear to be able to help support our entire community. And specifically, we've had investigators that are thinking about how to do this in the Black, Brown, African or American community. And within this, I think I constantly learn and appreciate that there are challenges for some communities that are really much starker, and that although I think we're making progress, I have the humility to appreciate that we still have a long way to go in some ways. And so, in this study that looked at 100 Black caregivers, within this, really understanding for those individuals along this journey from diagnosis to onboarding to care, what that journey was like and where the problems were, to realize that really there are problems that are either just harder or more intense for individuals that come from Black families. Within this, it comes from really multimodal. There are multiple directions in which this is hard, and I think it's a systemic issue. It's not just any one either group of doctors, providers, educators, but it's really a system where there are different issues. And in some cases, families also found that even for themselves, in terms of their own realization and acceptance of when something was an issue for their child, it could have been a spouse or a family member where it was also coming to a realization for that. But then also just deep difficulty accessing, in some cases, care and support. And in some cases, really the right care and the right support. And within this, feelings of isolation sometimes, until they could get to the point where they had enough knowledge, enough understanding, enough access to the treatment to start beginning to turn that into being able to be an advocate, being able to feel empowered, being able to turn that into action. And so I take away from that that we really have to understand each of us are unique in our experiences, but to be able to listen and learn to others who may have challenges that we may have to acknowledge and realize that we have not appreciated before, and to be able to bridge those gaps that we have. Within this, I think this is something that we have just begun to be able to address as communities, but as we're surfacing this, I'm optimistic that we can start to address the issues as we come to appreciate them more. Within this, the next couple studies I'm going to highlight, I think, are trying to think now about how do we bridge some of those gaps. These are not specifically just for Black communities, but I think about opportunities that we have in terms of filling gaps and realizing that in the diversity in this country, and this is again a US-based study, how we have people that get left behind that may be for economic reasons, they may be based on geographical reasons, they may be on racial, ethnic reasons, but how do we begin to fill these gaps? So, one of the things that we appreciate is that when we think about the modalities of how we can provide care, I think we can be more creative. I think there are some non traditional opportunities in terms of how to be able to teach and empower parents and be able to give them skills to be able to evidence in an evidence-based way to be able to help support their child. One of the things I think we as providers need to learn, though, is to be more open minded in terms of what those opportunities are and to be able to develop the evidence, the information about whether or not particular modalities work. And it won't be one size fits all. I want to underscore that we may have certain modalities, certain strategies that will work, but they may only work for a certain subset of families, be it issues or differences for the parents, be it issues for the child. And part of this is being able to personalize this so it's the right type of support for the right family. So, in this particular case, one of the strategies for supports that was tried was something called behavioral parent training, or BPT. Within this, being able to think about, again, training for parents in young children. So, what I mean by that is children who are the age of 2 to 6. So, many of these are preschool age children, as an example. And these are children that had issues that include, for instance, disruptive behavior or other things in addition to that are part of their autism. Within this, one thing that was interesting is that many individuals had not been offered this type of training or this type of program. In fact, the vast majority, 69%, had not been recommended for this. Um, but on the other hand, when provided this, and to be able to look and ask parents after they'd gone through the training, after they'd had the chance to try it and see whether or not it worked, then to survey them and see whether or not, from the parents' perspective, it seemed like it was doing something that was beneficial. The bottom line, if you look on the right for the overall satisfaction, is that the majority of individuals were either very satisfied or at least somewhat satisfied. And then you can break it down into different ways in which they might have been, they thought there was some benefit or satisfied with this, whether it was learning parent techniques, whether it was an improvement in their child's behavior, or an improvement in the parent-child behavior, or some or all of the above. You can see that for individuals, the majority of individuals found that there were things that were beneficial through the program. Again, it's not 100%. And so, as I said, part of this is being able to tailor and figure out for which parent, for which young children this will be beneficial. But by doing this, it gives parents the skills to be able to help support their child better. And I hope we can think about doing this and making this more accessible to more parents. So, in that line, in terms of thinking how to make more things available to more parents, there are some things that can be challenging. Challenges, I'll say, because parents are busy. Many parents have two parents that are working. There may be issues in terms of distance, depending on where you live, just proximity to a place that can provide therapies or supports. And so, in thinking about our busy schedules, our busy lives, how can we be able to get more supports to more people? So in this study, there was an interesting sort of hypothesis and an interesting idea of how could we provide services perhaps in the same way we're doing this webinar. Could we use telehealth, or I think of it as video visits, in terms of being able to deliver information about interventions, and in particular, two different types of supports. One that helps with fine motor skills or your hand skills, and another one that helps with social communication. communication, social verbalization in particular. And there were two different ways of being able to administer this. I will say, as a limitation of this study, it was a relatively small study with children ages 5 to 14. So, in doing this, this didn't have hundreds of people, but in fact, only 15 children, so a small number. But as I'm beginning to pilot this and to be able to understand whether there were differences, doing the in-person in F2F or face-to-face in terms of one way of doing this. And you can see that on the left when you're real time sitting at the same table in the same room with the person, or being able to administer many of the same activities, but doing it through a screen. And as you can imagine, doing it through a screen saves in terms of commute time to go to a center, perhaps is easier with scheduling. Um, and in doing so, there are many things that you can do sort of mirror, both on the screen as well as at home. And again, with a parent there, able to support a child going through some of those activities, for instance, with the fine motor skills or in terms of communication skills. So in looking at this, the white bars on the left are face to face. On the right is being able to do this in what we think of as on screen but seated play. So sitting at the table doing these activities. And statistically, there was actually no difference between the two groups, although again, the two groups were small. So, in thinking about this, also though, realizing and talking to parents that although video screen might be more convenient, it also had some technological issues. And all of you have had this problem. Your Wi-Fi goes out or your bandwidth isn't good enough. And so there are technical issues. And again, it may not be right for everyone. But in thinking about this and tailoring this, this suggests to me that this is a study that's a very early pilot in feasibility, but begs to understand in a larger way whether this is something that we can get access to more people. And as I think about this in particular, it would be helpful to know whether individuals in certain ages can be more appropriate for this and particular types of therapies. So we're going to go over the life course. I'm actually sort of drawing you through this. We started with very young children, and now we're going into adolescents and young adults. And what I love seeing the researchers think about are issues that are just very real. They just are the things that are timely and topical. And in this case, thinking about alcohol. Obviously, the drinking age is 21, so looking at individuals who are underage, not too far underage, but from the age of 16 to 20, and thinking about alcohol consumption and understanding for individuals with autism compared to those who are non-autistic, what the drinking patterns are, and very importantly, the motivation for drinking alcohol. And so I don't know how many of you have young people in this age range, but I don't think you'll find it surprising that even though individuals are underage and perhaps even underreporting, I don't know, but that individuals both with and without autism do drink. In fact, for those without autism, over a third drank in the last month. Importantly, in purple, for each of these categories, individuals with autism drinking less. So drinking less within the last month, drinking less in terms of number of drinking days per year, and drinking less in the point of blacking out from drinking. So we're seeing it less, but I would say we're still seeing a significant amount. For those of you who have parents within this age range, again, I don't know your children, but being able to talk with them about this, I think, is important. The other thing that's important, though, is understanding the motivations of why people are drinking, and this is actually, to me, the most important part about this study. So you can imagine that in some cases, people are drinking for social reasons. They may be at a party. This is part of the social sort of just being part of the group, being able to, be part of a group of young people that are having a good time and that are socializing. That was actually less common for the individuals with autism. Their motivation was not as much around the social aspect of doing this. And what was, I think, sort of little bit more disappointing to me is that for individuals who are drinking with autism, they were more likely to have a diagnosis of depression, more likely to have a history of bullying or exclusion, and with this, more likely to, I think, be using this in part. Not again as a social event, but more perhaps because of some pain that they were feeling. And with this, I think again, this is just the beginning, but I do think there's a different profile in terms of why individuals might be drinking and how they're using the alcohol. And I think this is an important, perhaps early warning sign for individuals who are having greater difficulty in terms of just how they're coping and trying to think about other healthier ways to be able to deal with some of those challenges. So thinking about these challenges, and again, I think a lot in terms of, again, being able to help individuals in terms of coping and management. Thinking about these are, again, uh, young adults, adolescents and young adults, so in that same age group, thinking about unmet needs they might have for social engagement and how that might be related to issues they have, feelings they have of depression. And so, looking at these different lines, individuals were rating whether or not they felt that their amount of social engagement was about right. So, those are the solid lines versus ones who are dashed, and looking about it in different domains, either time spent with friends, time spent on social events in the middle, or time spent in social activities. Individuals who felt that they were doing too little oftentimes had more depressive symptoms. And you can see that it can quite significant for those who felt they were spending too little time, much more significant depressive symptoms for those who seem to be having a self sort of assessment in terms of being having a gap in terms of what they would like to be doing. I worry that this can be reciprocally sort of interacting, that then as you become depressed, this can actually feed into more social isolation. And so hopefully this is something, again, that with early recognition, being able to get supports for individuals, we can break those cycles, but something that we need to be quite mindful of and really keep an eye on. In addition, thinking it now through the life course, and how things change. These are studies looking at individuals really from now younger children, age less than 6, through children in the middle, age 6 to 12, and then through adolescents, age 13 to 17. And these are different people in these different age buckets. So it's not the same person looking throughout their life, but looking at different people in different age groups and looking in particular at aggressive manifestations of behavior. And so thinking about how does this change? And for those of you with young parents or young children rather, trying to help give you some information, or with children in the middle, giving you information about what might be happening within adolescence. So the good news is, as children grow up, things get easier. And I think, and again, these are averages, but things tend to get easier, I think, as the child themselves is learning to cope with these issues and learning those coping mechanisms, understanding how to be able to accomplish things so it's not quite so frustrating and leading to aggression. And also in terms of for parents to be able to parents and caregivers to understand how to support individuals. So, looking at these lines, individuals with autism are in the solid lines, individuals who without autism in the dashed lines. So, there's a comparator group. So, you have some sense of how things change for all children over time. And you'll see that, in fact, in some cases, there are quite a few parallels. So, looking on the left side with verbal aggression, so yelling or screaming, for instance, you can see that things can change over time and that things peak in middle age, but as adolescents get older, things tend to calm down. With physical aggression, in particular for individuals with autism, it's at a peak for the youngest of children. And thankfully, you'll see that that solid line in the middle, things continue to decrease over time. So things get better. And then similarly for disruptive behaviors on the right, you'll see exactly parallel curves between individuals with autism or without autism. And again, things get better over time. So hang in there for those of you, especially with young children. Hopefully there's some optimism ahead. So thinking about now a different dimension, and within the community, we have individuals who may have varying sexual identities. And how is life depending on how you self-identify in terms of sexual orientation? Well, overall, not surprisingly, things are harder. So, for individuals, these are self identified approximately 650 individuals with autism who are adults, self identified as either heterosexual or a sexual minority. And on the top, all of the sexual minorities clustered together for the sake of simply being able to get larger numbers. And then on the bottom, excuse me, although I know it's the spaghetti colors are a little bit hard to differentiate, different colors by gay, bisexual, pansexual, or asexual. Within this, the easiest I think is to see the top, and that is for any of the categories, whether it's physical health, psychological health, social relationships, any of those categories, things are tougher for individuals who are in a sexual minority. And this is mental health issues, especially, or symptoms being anxiety, depression, ultimately leading to lower quality of life, is something that I know we can do better in. And so as we go forward, I think this is an area where we can learn to support our communities better and be more accepting as well as supportive as we go forward. Um, Within this, we also want to think about much longer term. And so the next few slides are thinking about much longer term for those of you with young children, for those of you who are adults. It's the now, but we do want to think about across the life course. So within the community, we also think not just about mental health and behavioral health, but we also think about physical health. And so with this, there can be issues that may be secondary effects that our mind has on our body. And as I think about that, I think about longer term, the toll that things can take, especially on the heart. Thinking about the heart or metabolically the body and what some of the factors can be, either because of the way that we're physically active, what we put in our bodies, both in terms of medication, alcohol, food, but really it's wellness in terms of our body and what some of those risk factors may be as we think about longer term, those things that a condition like autism can have. And it is significant. And I think it's something for us to be mindful of and to try and have balance as we think about healthier lifestyle habits to be able to keep our bodies and our minds healthy. In doing this, it may not surprise you because many of these parallel what we see in the general population. So these are not exclusive to adults with autism, but in fact, there are significant issues when it comes to cardiovascular risk, with many individuals having one or more things that increase the risk of heart disease down the road. Some of those most common factors include obesity or being overweight, issues with higher cholesterol, issues with higher blood pressure, and for a small number, diabetes, and in some individuals, a combination of multiple factors. Why do I bring this to your attention? I would argue that for all of these, there are interventions. There are things that can be done that can take care of these or at least minimize the risk. On the other hand, individuals with autism are less likely to access both their doctors as well as some of the medications or some of the changes that can be helpful in terms of doing this. And these act together. They act together in part because some of the medications that we use for some of the behavioral issues can actually make this worse, can actually add to weight gain, can add to high blood pressure, can add to diabetes. And so it's important to be especially vigilant of these conditions and to be able to make sure that we're managing all of these factors as best that we can, and when necessary, take medications or make lifestyle modifications to try and minimize these risks. Within this, there are also a group of medications that we use again for behaviors that are called anticholinergics. That sounds like a mouthful. So I put on the right some of the medications that these are found in. This includes over-the-counter medications like cold medications, including antihistamines, but also importantly include medications like antidepressants and antipsychotics. Why am I bringing this up? Well, depending on how much of these medications one takes, an anticholinergic cognitive burden can be calculated that essentially summarizes all of these medications, and in this time puts them into two groups, lower or higher burden on the left or the right. What you may be able to see from these violin plots is that on the right, the yellow graph is shifted upward. And what that means to me is that there are more problems for that group of individuals with memory over time than the group on the left. Now, certainly all of us as we get older can have memory issues. We'll forget something once in a while. But when you look at what's happening overall, a slightly higher concern for memory issues for people taking anticholinergic medications. So again, I'm not saying that this is necessarily cause and effect. It could have been that there's some of the issues going on underlying that require medication are also contributing to memory issues, but it's important as we want to be long-term, have our minds work. So as we think about this, how do we think about this in terms of over the lifespan issues that might be coming up later? And when I say later, I'm not talking about in your 20s, but I am talking about in middle age and older age. Are there things that become more challenging for adults with autism? And I think the answer that is emerging is yes. Not to say for absolutely everyone, but for certain individuals, more problems on the left in the blue bars for individuals with autism compared to in the green bars on the right, more problems, for instance, with judgment, less interest in leisure activities. On the right, more problems with handling complex finances, more problems with forgetting about appointments, and more problems with everyday thinking or just general memory. And so as we think about this, something to be mindful of, something to help in terms of planning, there are certainly ways of being able to help support individuals who may have these issues, increasingly organizational ways to help, for instance, additional reminders, additional things that can help support if you're forgetful, additional ways to write things down, additional ways to be able to have electronic gadgets help with things. But just to be aware of this, because if this is an issue, someone may need that additional support to be able to live their fullest life. And we want to be able to fill those gaps and be able to help with those supports. So we're coming to the end, but as I wanted to give you a peek into the future of what we're planning for Spark, and basically the answer is more of the same. We're not going anywhere. What I mean by that is we're continuing Research Match. We're continuing, for those of you who haven't gotten in your saliva kits, if you'd like to do that based on what you've heard today, to be able to see if there are any genetic results, please go ahead and do that. And we'll continue, as I said, giving research summaries and reports and articles, and have families and individuals tell their stories on video as well as in written format. We're going to continue doing everything we've been doing. We are continuing to do increasingly detailed analysis of sleep. So we have had some families that have been incredibly dedicated to help us monitor sleep and activity at home. They've been wearing gadgets, including smartwatches, this headband that you see on the forehead, as well as a sleep mat going under their mattress, because we heard from you. Sleep is an issue for several people, and getting a good night's sleep helps in terms of memory, behavior, clear thinking. And so we're interested in understanding to monitor whether this is an issue. And importantly, if we can monitor it, we can see if we can make a difference. We can see if there might be things that will improve sleep. And if we can improve sleep, maybe we can improve many other things associated with it. So we're not done. But we are in the middle of collecting the data, being able to analyze what parts of the data are reliable. And as we're doing this, I want to thank the families who've been part of this, because I know it isn't easy. individuals with autism in those families, individuals without autism in the family, and doing it for about 2 to 3 weeks. It is really a labor of love. So we thank you for doing that. And as we do this, we hope, stay tuned, we might have more scalable ways to go beyond just the 100 families that we've started with. In doing this, we are committed on an ongoing way to be able to understand the diversity and be able to understand the journey that we're all on together in terms of understanding this over the life course for many different people in many different ways. And we want to hear from you. So as we do this, we hope we'll give you will give us feedback in terms of the burning questions, help us to help guide researchers in terms of the gaps in our knowledge, things that we can do to be able to continue working together. I'll plant a seed means that we still care about you after you turn 18. But one of those things is when you hit that magical age, it's important to be able to have the person who came into the study as someone consented by their parent to be able to consent for themselves if that's appropriate, or have the parents say that they are in fact their guardian, continue to be their guardian, and will continue on the journey. As we're doing this, we know we send you various different both Spark Central surveys. We're doing this so that you don't have to do this for every research match study, so that this is something that we consider core to Spark and important for all researchers, as well as those individual research match studies that the individual investigators are using. As we go through this, we do hope that we'll be able to forecast for some of you some helpful hints of how to be able to help support the individuals you love with autism, and as we do this, be able to learn from each other. So I'm going to stop there and hope that Dominique can guide the discussion with me.
Yes, absolutely. Thank you so much, Dr. Chung. We'll jump right in with the few minutes we have left for some questions then. So going back to the beginning of the presentation, you talked a little bit about how participants can submit their saliva kits and what that looks like and returning results to participants. Are you able to speak to why the % of participants who've received a genetic result is that 9% number, like why it is on the lower end?
Sure. It's a great question. And some of you might have said 9%. That seems very low. I have a family history of autism. I may have 2 children, or myself and my child both have autism, and I didn't get a result. How could that be? It must be genetic if we have, multiple people in our family. And I think it speaks to, number one, we're humble enough to realize we don't know everything. The challenge from a scientific point of view is it's not as if there's one gene for autism. There are likely hundreds of genes for autism, and we like to be confident in what we're returning because we don't want to make mistakes, and we don't want to tell you something and then come back 6 weeks later and say, oops, we got that wrong. We like to make sure that the information we're giving is true information. So with that, we have a relatively high bar in terms of what we'll return. I will say for some of you, if you feel, and many of you should, I'll say, feel that going to see a genetic doctor on your own, I will tell you that sometimes that genetic doctor might return something that's, a lower certainty, that's not as certain as we are. And so if I were doing this was seeing patients yesterday, if I were doing this because you came to see me as a patient, I might return something in that way because I know you very personally. I'm able to make a judgment call. I know what makes sense. I know what fits. And so that 9% might be 13% as an example. So a little bit higher, but not a ton higher. The final thing is that as we have greater numbers together, we will learn more, and we're not finished returning results. So even for those of you who joined 6, 7 years ago, we still are at this. We still keep looking. And as soon as we find something that meets that threshold, we will return it to you.
Great. Thank you. And that's interesting to hear the difference between, using Spark versus going to a geneticist on your own. I think that's hopefully helpful for folks. Okay, so looking a little bit more at that middle section of the presentation where we dug into some research, looks like Spark is doing a lot of research with autistic adults, which is exciting from what I'm hearing from folks in the chat, and I know we've heard in other ways as well. How have you seen this translate? How have those results of those studies using autistic adults translated into, treatments, therapies, et cetera? Have you seen anything of note?
So I think this is something that we're still in the early stages of this. So I haven't seen any of this, for instance, in terms of like one universal clinical care guideline in terms of like this happens now for every adult with autism. What I do think should happen, and I think is something you can certainly take these publications, you can take the Spark webinar to your doctors in terms of being able to say, look, I'm an adult with autism. Am I getting checked for heart disease? Am I getting checked for my cholesterol level? Are you checking my blood pressure? You know, what can we together do about this? So I do hope that people feel empowered to take, and the reason why we have this as peer-reviewed publications is there's a level of sort of checking and making sure that this is good information. So that's something that doctors are more likely to listen to, and you should definitely feel empowered to be able to bring that up. In certain cases, like I said, if it might be things about drinking for adolescents and young adults, I think at this point it's something that for parents, I think all parents need to be aware of. And sometimes it's hard to figure out what your kids are doing, I admit, whether your kids have autism or not. But I think it's something to be sort of help parents to be aware. I think sometimes I myself, as a parent of young adolescents and young adults, am naive in terms of thinking they're angels, and in certain cases, but to realize when I think back to myself, like we all just went through that phase, and to be able to support your young person. Sometimes there are tough days and tough times, and we want to make sure that we can get them through those bumpy parts.
Great, thank you. And another research match related question. How are you, or have you seen or research match studies that are meeting the needs of the profoundly autistic community in like ways that are helping them to participate and be represented in research? And maybe that's not research match, maybe it's just autism research broadly. We could talk about that.
Yeah. So what I'll say is, so there are things that are going across for that group broadly. What I will say I've seen a little bit more traction on is that, and this is part of what Spark had designed, for many of those individuals, they are the ones who are receiving the genetic results. We are more likely to recognize the genetic things for that group. Once they are finding their underlying genetic group, I am seeing a lot more movement in terms of those now individually rare genetic conditions, but movement in terms of those families helping each other, learning from each other, recognizing things that are not broadly an issue, but for certain subsets might be an issue. And there can be even things as significant as cancer risks or certain medications that may be quite helpful, but helpful to a very small sliver based on one gene. For that, I do think we're starting to now think about how to monitor behavior in a more granular and effective way. And what we're learning with those communities, I think, is going to come back for those with profound autism writ large. I think it's the same assessment tools that we're starting to understand, same way of looking at brain waves, same way of being able to understand a meaningful difference. And those, I think, are going to be generalizable. So these kind of flip back and forth between Spark and also our sister study, Simon Searchlight, and then back again from Simon Searchlight to Spark. So we work together.
Great. And this might be a big question for the last 30 to 60 seconds here, but what is your main takeaway from all this incredible research happening, and what should be the number one thing you want parents, caregivers, or even autistic adults advocating for themselves to take away from this presentation today?
What I want you to take away from this is that together we're better, and together we can do it. I really truly think that by you all thinking of the questions that matter, us be your enablers, your engine to help bring researchers together to do it with you, and then being able to give you back that information, that cycle of learning together, together we're better, and together we can do it.